Nurse Aide Test Prep Dallas TX. Question 1. A client with a catheter should have perineal care performed. Option A, daily during the bath. Option B, at least once a shift. Option C, only if soiled. Option D, twice per shift. The correct answer is option B, at least once a shift. Clients with indwelling catheters need perineal care at least once per shift to prevent catheter-associated urinary tract infections, CAUTI. Daily is insufficient, infection can develop within hours. Question 2. Which approach is best when caring for a client with Alzheimer's disease? Option A, use complex medical terminology. Option B, use short, simple sentences and give one instruction at a time. Option C, speak in a loud tone to get the client's attention. Option D, ask open-ended questions. The correct answer is option B. Use short, simple sentences and give one instruction at a time. Clients with Alzheimer's have difficulty processing complex information. Short, simple sentences with one instruction at a time are most effective. Complex terminology and open-ended questions overwhelm them. Loud tones are perceived as aggressive. Question 3. When providing oral care to an unconscious client, the nurse aide should: Option A, brush the teeth vigorously. Option B, use a sponge-tipped swab moistened with mouthwash. Option C, place the client on their side and swab gently. Option D, skip oral care for unconscious clients. The correct answer is option C, place the client on their side and swab gently. Unconscious clients should be positioned on their side to allow fluids to drain, preventing aspiration. Gentle swabbing with a sponge-tipped applicator should be used. Oral care should never be skipped, it prevents pneumonia and infection. Question 4. When performing chest compressions on an adult, the nurse aide should compress the chest to a depth of: Option A, 1 inch. Option B, at least 2 inches but no more than 2.4 inches. Option C, 3 inches. Option D, 4 inches. The correct answer is option B, at least 2 inches but no more than 2.4 inches. Adult chest compressions should be at least 2 inches deep but no more than 2.4 inches. 1 inch is too shallow, 3 to 4 inches may cause injury. Question 5. When is alcohol-based hand rub acceptable instead of soap and water? Option A, when hands are visibly soiled. Option B, after using the restroom. Option C, before touching a client with clean hands. Option D, after caring for a client with C. diff. The correct answer is option C, before touching a client with clean hands. Alcohol-based hand rub is preferred when hands are not visibly soiled. Soap and water must be used when hands are visibly dirty, after using the restroom, and when caring for C. difficile. Alcohol does not kill spores. Question 6. Which method of temperature measurement is considered most accurate? Option A, oral. Option B, axillary. Option C, tympanic. Option D, rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 7. What should a nurse aide do if they experience a needle stick injury? Option A, wash the area and report it immediately. Option B, wait to see if symptoms develop. Option C, apply pressure to the wound. Option D, ignore it if no blood is visible. The correct answer is option A, wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 8. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, Hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing. Question 9. When should a nursing assistant perform hand hygiene? Option A. Before touching a client. Option B. After removing gloves. Option C. After touching client surroundings. Option D. All of the above. The correct answer is option D. All of the above. The CDC's 5 moments for hand hygiene include before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 10. What should a nurse aide do if a client refuses isolation precautions? Option A. Ignore the client's refusal. Option B. Use restraints to keep the client in the room. Option C. Educate the client and report to the nurse. Option D. Discontinue isolation. The correct answer is option C. Educate the client and report to the nurse. The nurse aide should explain the purpose of isolation and report refusal to the nurse. Restraints are never appropriate without a physician's order. Ignoring refusal or discontinuing isolation puts others at risk. Question 11. The nurse aide enters a client's room and finds the client on the floor. The aide should: Option A. Pick up the client immediately. Option B. Assess the client, call for help, and do not move the client. Option C. Leave the room to get the nurse. Option D. Document the fall and call the family. The correct answer is option B. Assess the client, call for help, and do not move the client. The nurse aide should assess the client, call for help, and keep the client still to avoid worsening injury, possible fractures or spinal injury. Moving without assessment could cause harm. Question 12. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 13. A dying client requests to see their pastor. The nurse aide should: Option A. Tell the client the pastor is busy. Option B. Contact the facility chaplain. Option C. Change the subject. Option D. Tell the client to pray alone. The correct answer is option B. Contact the facility chaplain. Spiritual support is important at the end of life. The nurse aide should contact the chaplain or the client's clergy. Dismissing the request is inappropriate. Changing the subject avoids the client's needs. Question 14. Which precautions are used for clients with MRSA or VRE? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Contact precautions. Option D. Standard precautions only. The correct answer is option C. Contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 15. The nurse aide should report which finding as a possible sign of abuse. Option A. Bruises at different stages of healing. Option B. Bruises on the shins. Option C. A client who is hard of hearing. Option D. A client with memory loss. The correct answer is option A. Bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 16. Which is a violation of HIPAA? Option A. Discussing client care with the client's family who is present. Option B. Discussing client information in the elevator with another aide. Option C. Documenting care in the client's chart. Option D. Reporting client information to the nurse. The correct answer is option B. Discussing client information in the elevator with another aide. Discussing client information in public areas, elevators, cafeterias, hallways, violates HIPAA because conversations can be overheard. Discussing with family present, documenting, and reporting to the nurse are HIPAA compliant. Question 17. A client tells the nurse aide that they want to harm themselves. The aide should: Option A. Keep the information confidential. Option B. Tell the client that they are being silly. Option C. Report it to the nurse immediately. Option D. Promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 18. To prevent skin breakdown, the nurse aide should: Option A. Keep the skin clean and dry. Option B. Keep the skin moist with lotion. Option C. Rub bony prominences vigorously. Option D. Use only powder on the skin. The correct answer is option A. Keep the skin clean and dry. Clean, dry skin is the first line of defense against pressure ulcers. Moisture from sweat, urine, or feces softens skin and increases friction. While lotion is important, too much moisture is harmful. Rubbing vigorously damages tissues. Question 19. The nurse aide should speak to a client who is hearing impaired by: Option A. Speaking very loudly. Option B. Speaking slowly and clearly while facing the client. Option C. Writing everything down. Option D. Asking a family member to translate. The correct answer is option B. Speaking slowly and clearly while facing the client. Speaking slowly and clearly with normal volume and facing the client allows lip reading and visual cues. Shouting distorts sound and is uncomfortable. Writing everything down may not be practical. Question 20. The family of a dying client is upset. The nurse aide should: Option A. Ask the family to leave. Option B. Offer support and a private place to talk. Option C. Ignore the family. Option D. Tell the family everything will be fine. The correct answer is option B. Offer support and a private place to talk. Family members need support too. Offering a listening ear and a private place shows compassion. Asking them to leave or ignoring them is insensitive. False reassurance is not helpful. Question 21. Systolic blood pressure represents: Option A. The pressure when the heart is at rest. Option B. The pressure in arteries when the heart contracts. Option C. The pressure in the veins. Option D. The pressure in the capillaries. The correct answer is option B. The pressure in arteries when the heart contracts. Systolic pressure is the maximum pressure during left ventricular contraction, systole. Diastolic pressure, option A, is when the heart rests. Venous and capillary pressures are not part of standard blood pressure measurement. The systolic is the first sound heard. Question 22. A client who is dying expresses a desire to talk about their life and experiences. The nurse aide should: Option A. Redirect the conversation to something more pleasant. Option B. Provide active listening and allow the client to talk. Option C. Tell the client not to worry. Option D. Change the subject to the client's care. The correct answer is option B. Provide active listening and allow the client to talk. Life review is an important part of the end-of-life process. Active listening validates the client's experiences and supports their emotional needs. Redirecting or dismissing denies them this important processing opportunity. Question 23. When dressing a client with a weak right arm, the nurse aide should: Option A. Dress the right arm first. Option B. Dress the left arm first. Option C. Dress both arms simultaneously. Option D. Dress the stronger arm first. The correct answer is option B. Dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 24. The best way to communicate with an unresponsive client is to: Option A. Avoid talking to them since they can't hear. Option B. Speak to them as if they can hear and respond. Option C. Speak loudly near their ears. Option D. Only speak to family members. The correct answer is option B. Speak to them as if they can hear and respond. Many unresponsive clients can still hear and may benefit from hearing familiar voices. Speak calmly, explain procedures, and use the client's name. Hearing is the last sense to go. Question 25. When giving a bed bath, water temperature should be approximately: Option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns.